are some do's and don'ts Baptist Health wants you to know before you make an appointment. Here are 3 things to know right now. In the more than 2 months doctors have been giving the vaccine, they've learned a thing or two. Number 1, don't pre-medicate. Taking ibuprofen or other pain meds can lessen your immune response, the opposite of what you want. If you do have a rare reaction, it likely won't show up for a couple of hours, so just wait until then to take any medication. Next up, something you might not think of.
Don't want to be eating right after you take the vaccine. If we did need to help you out medically, if you did have some rare reaction, we would definitely want to be able to respond the best way. So it would be best for you not to have just eaten.
Baptist Health's Pharmacy Director Angela Sandine says you do want to eat and drink normally before your appointment so that you don't get woozy, but wait a little before eating immediately after your shot. And lastly, don't expect to leave immediately after you get that shot. Rare side effects are possible, very rare though, like I said. We'll tell you just how rare in a second, but just in case something does pop up, staff will want you to be there so they can monitor you for about 15 minutes. So make sure to take into account that extra time afterward. As promised, a new CDC report shows us just how many people are experiencing side effects from the vaccine out of the millions who have gotten that dose.
That if you look at the potential side effects of virtually anything that we take, doesn't mean that the drug is dangerous. Somehow people think that perhaps zero risk is achievable with some things, but I can't think of anything that has zero risk.
Dr. Richard Rothenberg with the School of Public Health at Georgia State University says the CDC report is important for people to see to show exactly what the risks are of taking the COVID vaccine. But turns out the risk is minimal. The report shows that out of nearly 14 million people in the U.S. vaccinated during the first months of the vaccine, fewer than 7,000 people experienced any side effects at all. We're taking a closer look at the whole study and what the most common side effects reported were coming up at 4:30.